Afternoon. I'm Allison Arwady, Commissioner at the Chicago Department of Public Health. I'm joined by Dr. Geraldine Luna, a medical director at the Chicago Department of Public Health, and we're here to give an update on COVID numbers in Chicago, as well as talk about some things that are happening in the vaccination realm, some new incentives, some new programming. So thanks very much for joining us. First of all, we continue to follow all of our COVID metrics as we have from the beginning. If we look at our matrix of progress, you see that everything remains in the lower risk category, or even in the case of positivity, in what we're considering controlled transmission. So to put a finer point on that, we're averaging just 44 new cases a day here in Chicago right now. Our positivity is at 0.6%. Our hospital beds, we've got about 117 non-ICU beds filled with COVID patients across Chicago. That's the lowest we've seen, and about 47 filled with COVID patients in the ICU. And those are 7-day averages. In fact, I am expecting that probably within the next week, those will also come under our controlled transmission. So everything is continuing to head the right direction in terms of our metrics. If we just look at the graphs on this quickly, and for those of you who are watching at home, you can find all of this information, as always, on chi.gov/COVID-. You see here, our 44 new cases per day is down from an average of more than 3,000, and we had days of almost 3,500 cases a day. Really good progress, the lowest since the pandemic began. And if we look at our positivity, it's not just that we're at the lowest since we began, 0.6%. All of our race ethnicity groups in Chicago also have a test positivity less than 2% right now. So if we look at Latinx Chicagoans, the positivity there is 1.6%. Among Black Chicagoans, it's 1.2%. Among white Chicagoans, it's 0.6%, and among Asian Chicagoans, it's 0.4%. So in all of these, we're not just watching the city as a whole. We're looking at neighborhoods, we're looking by race, ethnicity. All of these continue to move in the right direction. We are averaging fewer than 10 new COVID hospitalizations every day in Chicago residents, the lowest that we've seen since the beginning of the pandemic. We do have about 150 people still hospitalized, also the lowest. And we're averaging 2 COVID deaths per day in Chicago residents. That's similar to where we were last summer. We've not had a day in Chicago without a COVID death since last September. I do think it will be coming soon. We've had a couple of days with just 1 COVID death, but our average is still at 2 per day. So we're not done here, but definitely making really good progress. I do want to highlight, though, that unvaccinated and older Chicagoans remain at the highest risk for COVID hospitalization and death. Where we look at Chicagoans in their 70s, all the way back to the beginning of the outbreak, Chicagoans in their 70s only represent 4% of our total COVID cases, but 26% of our total COVID deaths. And if you look at Chicagoans who are 80 and older, that's less than 3% of our cases, but 32% of our deaths. So more than half of the deaths in Chicago have been, from COVID-19, have been in people over the age of 70. And the vaccines work, including for older people. Since mid-January, 97% of the COVID hospitalizations in Chicago and 98% of the COVID deaths in Chicago have been in people who were not fully vaccinated. Where we look at vaccine, we're making progress. We've done almost 2.8 million COVID vaccines at Chicago sites. And 54% of all Chicagoans have gotten at least a first dose of vaccine. If we just look at adults, 65% over 65 have gotten a first dose, and 71% of those over 65 have gotten a first dose. It's not where we want to be, though, particularly for that oldest group, that 65 plus. We're still behind the national average for that oldest group, and they're the ones at highest risk. And if we put a little more detail on this, you can find all of this information on our dashboard. This is showing you the percentage of Chicagoans by age that have gotten at least a first dose of vaccine. And you see it's actually people in their 50s here that are the most vaccinated. 76% of Chicagoans in their 50s have gotten at least a first dose. But as you move to the right and you see the older groups, only 71% of people in their 70s and only 63% of people in their 80s. So we continue to be concerned concerned that there are older Chicagoans who are still not protected. On the other end, you can see about 38% of our 12 to 17-year-olds have gotten a first dose. That is our fastest growing group. Of course, that's the most recent group to be eligible, and we're making good progress there. One of the best ways that we've found to reach older Chicagoans has been through our Protect Chicago, what was initially our homebound program, and then our at home. So since March, we started first with people who had difficulty leaving their home, and then we expanded it so that anybody over the age of 65 in Chicago, anybody with a disability, anybody leaving home could call, and we would schedule an in-home vaccination free of charge. We've vaccinated more than 3,500 Chicagoans through that program, and you can see on this map, they've really been throughout the whole city. The purple dots and the red dots, those are people who were over 65, and this has been an important program. So we're excited to announce today that we are expanding Protect Chicago at Home to all Chicago residents. All Chicago residents over the age of 12 are now eligible for in-home COVID-19 vaccination. I want to reiterate that this is not taking the place of vaccine that remains available at pharmacies, at the doctor's office, at our events. But now, any resident in Chicago, this is completely free, regardless of age, neighborhood, immunization, or insurance status. As always, there is no insurance required. There is no copay. There is no billing after the fact. There is also no formal identification required. One of the reasons we're emphasizing this is we want to encourage people who may have folks in their household not yet vaccinated, especially if they're older, make it a family affair. You make one appointment for your whole household, but up to 10 people can be vaccinated per household. We do have both Pfizer and J&J available. We will come back and do that second dose. And we are the only large U.S. city that has expanded this kind of eligibility to anybody in Chicago. So we're excited about that. You can sign up at chicago.gov/at-home, or as always, call our line at 312-746-4835. You do sign up by region, and we'll be looking to see what the uptake is and growing this as necessary. But also, to sweeten the deal a little bit, I want to thank Grubhub because Grubhub has given us a $100,000 in-kind donation to help support this launch of the at-home vaccination for all of Chicago. So one per household, when you sign up for at-home vaccination, again, that can be up to 10 people in your household, you will receive a $50 gift card from Grubhub. That can be used immediately at any location where Grubhub is available. So if you make it a family event to get the vaccine, you can also order in food and have dinner as a result. You use the same process for signing up. Gift card distribution will begin June 28th. And I hope that this isn't the only reason that inspires you to get a vaccine. But if you know anybody, especially anybody older, who hasn't done this yet, reach out to them and let's make it an event. Let's get vaccine to their house and let's have a Grubhub meal as a result. So thanks again for that to Grubhub. I also want to highlight that we continue to do a lot of mobile and hyperlocal events. And what you're going to be hearing is that over these next few weeks, we are going to be backing off and closing down a lot of our larger pods. Thursday, for example, is the last day that the United Center will be vaccinating. But as we move from these sites that are set up to do thousands of vaccines, we're really doing a lot more work to bring vaccine into communities, make sure people who maybe it's not first on their list to get a vaccine, when they see this available, then we're seeing people make this decision. So to give you a sense of some of that range, just later this week, in addition to being at CTA stations, which is something we've seen very successful, particularly as people are on the way home, the ability at a busy either subway station or bus station to get that vaccine. We're going to keep building on that. Our vaccine bus, of course, continues all over the city, but we're thinking about where there are city services. So like on Thursday, city key card printing in Austin, we know is very popular. We'll be offering free vaccine there. On Saturday, we'll be at the 63rd Street Beach, and we'll also be at Pride in the Park, Millennium Park. Really excited about that. And then on Sunday, you can see there's a couple of churches. We continue to do a lot of partnering, especially where we're thinking about older Chicagoans. This is one in Greater Grand Crossing and one in Austin. But we continue to really work, and you're going to see us out through the summer, making sure that there are mobile and hyperlocal events available. To find out the details of these, because there are dozens and dozens of them, you can always go to our vaccine website or directly there at chicago.gov/vaxcalendar, and you can see what's going on that's fun in your part of Chicago. And I want to remind people that this Saturday is the day that you can get a free Lollapalooza pass for getting vaccinated. So this Saturday, there are 1,200 free single-day passes, and big thanks to Lollapalooza and C3, the organizers, for making these available. The 4 city sites that will be open on Saturday, these are 4 of our pods, are Wilbur Wright College, Richard J. Daley College, Kennedy King College, and Malcolm X College. And I'll refer you to chicago.gov/COVIDVax for the details. But the idea is you go to one of these sites to get the pass for that day. So if I want to see the Thursday lineup, July 29th at Lollapalooza, I go to Wilbur Wright College on Saturday to get my COVID vaccine. Each of these sites are being transformed into a Lollapalooza experience. There's DJs, there's giveaways. You do have to register for this one. Almost everything else, you can walk up, you can sign up, but you do need to register for the Lollapalooza passes. And these have been going quickly, so we encourage you to register and come out on Saturday, get your vaccine. And again, thanks. This is probably a little more aimed at the younger people than the older people, but we really appreciate the way just so many partners across Chicago have been stepping up. And I finally just want to remind people that if you have not heard, there is a statewide vaccine sweepstakes, $10 million that's been made available. The governor announced it, and if you get vaccinated with at least your first dose before July 1st, that makes you eligible for that first drawing. And there's $7 million in cash prizes. This is federal COVID funding that is available to adults. So there's 3 $1 million jackpots and 40 $100,000 cash prizes. And then for children, 12 to 17, you can't get a cash prize, but I'm actually even more excited about this. There are 20 $150,000 college savings scholarships that are being given away. These are the Bright Start 529 college scholarships, so you can use them anywhere where FAFSA is taken, private, public, etc. And it is the equivalent of a full 4-year ride at a public university in Illinois. And so to be entered, you do not need to sign up. You do not need to fill out a form. You do not need to wait in a line. You just need to be vaccinated. I mean, if you're an Illinois resident in the registry, you would be contacted. The first drawing is Thursday, July 8th, and then they continue through the end of August. I refer you to allin.illinois.gov if you want to learn more about that. But again, these are really ways to raise awareness about COVID vaccines. Certainly when I've been out and talking to people, not everybody has heard about this. And, you know, the reason I am interested in getting people vaccinated is not related to winning a cash prize. It's related to the fact that this is how we save lives. This is how we help avoid more of a surge in the fall and winter. But regardless, I know there are a lot of people who might go out of their way if they have an opportunity to be entered in a $1 million giveaway, for example. So with that, I will bring up Dr. Luna, who will provide some remarks in Spanish, and then we will come back and take all of your questions. Thanks for everything everyone has been doing to protect Chicago. It is all of you that have gotten us this far, and we need to keep making progress on vaccination to maintain this progress as we look ahead.
Sí, muy buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les quiero dar muy buenas noticias. Nos encontramos en un punto de la pandemia con los números más bajos. La seropositividad es 0.6%, menor de lo que lo tuvimos la semana pasada. 44 casos, es la mitad de lo que tuvimos la semana pasada. Y cuando miramos por etnicidad, tenemos menos de un 2% de seropositividad del COVID-19 aquí en Chicago. los adultos de 50 años han sido el número más alto registrado recibiendo la vacuna, y los niños, ya tenemos 38% de nuestros niños vacunados. Es un número mucho mejor que el que solíamos tener, pero tenemos que seguir trabajando. Nuestros niños van a ir a sus escuelas y necesitan estar protegidos. Vemos que los mayores de 80 años no vemos mucho progreso en la vacunación en este grupo etario. Tenemos 63%. Necesitamos fomentar que nuestros adultos se vacunen porque la mortalidad es más alta en este grupo. Entonces, cuando miramos la vacunación por etnicidad, 62% en asiáticos, 60% en nuestros caucásicos, 45% en nuestros latinos y 37% en nuestros afroamericanos. El esfuerzo es gracias a todos ustedes y estamos en un muy buen lugar para terminar nuestra pandemia. Depende de ti que te vacunes y la acabemos de una vez. Quiero compartir con ustedes los programas que tenemos, incentivos de vacunación para todas las familias aquí en Chicago. El programa de vacunación del Departamento de Salud Pública, Protege Chicago at Home, abre sus puertas a todo el mundo. Ahora está disponible a todos los habitantes mayores de 12 años. No tienes que tener 65 años para recibirlo o estar incapacitado en su hogar. Entonces, Grubhub, le damos las gracias a Grubhub, que donó tarjetas con valor de $50 para que pueda recibir esa vacunación en su casa. Las citas se pueden reservar ahora y la distribución de tarjetas comenzará el 28 de junio. Los participantes podrán usar las tarjetas de regalo inmediato en lugares donde el Grubhub esté disponible. Puede recibir la vacuna en su hogar y a la misma vez invitar a todas las personas a almorzar o a comer, dependiendo de la hora, ¿verdad? Con Grubhub. Las tarjetas de regalo representan una donación de más de $100,000 de Grubhub. La vacunación es la mejor manera de proteger a su familia y a la comunidad del COVID-19. Y estamos agradecidos grandísimamente al Grubhub por su donación. Ahora las familias, como les dije, pueden disfrutar en su casa de la vacunación y recibir su comida a domicilio. Es efectivo y una manera muy eficaz de celebrar juntos en familia. La vacunación en el hogar ofrece la posibilidad de elegir entre Pfizer, si son personas de 12 años o más, y Johnson Johnson si tenemos 18 años o más. Se pueden vacunar hasta 10 personas en el hogar y recibir la tarjeta de regalo por hogar. Llame al 312-746-4835 para hacer su cita para poder recibir su vacunación. O puede visitar a chicago.gov/COVID-Vax para más información. Toda vacuna de COVID-19 se ofrece sin costo para todos, no requiere seguro, no requiere identificación, no importa su estado migratorio. Hasta la fecha, Protect Chicago at Home ha administrado en el hogar más de 3,500 vacunas a los habitantes de Chicago. Esta iniciativa inicialmente se logró para llevar vacunas a personas mayores de edad confinadas al hogar y personas con incapacidad física o mental en el mes de marzo y mayo. Y el programa empezó a incluir a todas las personas mayores, pero ahora abre las puertas a todo el mundo. La ciudad de Chicago también está ofreciendo otros incentivos para vacunación. Estamos hablando de Lollapalooza. Esta actividad empieza en julio 19 por 10 semanas y puede recibir pasadías gratis por uno de los días de Lollapalooza si recibe su vacunación ahora. Se regalará más de 1,200 pases de un día de aquellos que hagan una cita especial en los 4 sitios de vacunación de la ciudad, empezando el sábado 26 de junio. Así que si no ha recibido su vacunación, este es el momento. Cada sitio ofrecerá pases para un día diferente del festival musical. Se requiere cita y estas citas están disponibles en chicago.gov/COVID-Vax. Tenemos toda la información para que haga su cita. Y cada sitio administrará vacunas de Johnson Johnson, así que estas citas son para personas de 18 años o más. Pero atención, las personas que ya están completamente vacunadas contra el COVID-19 también son elegibles para los pases de Lollapalooza. El domingo 27 de junio se publicará un enlace para los pases de las redes sociales y en el Departamento de Salud Pública en el sitio web. Y anden pendiente que ya tenemos la lotería estatal. Si recibe su vacuna antes de julio 1, se puede suscribir. Y hay más de 10 millones de dólares es lo que cuenta. Y si es más joven, de 18 años, entonces también hay becas para las universidades y los colegios. Así que gracias, Chicago, hemos llegado a donde hemos llegado, gracias a ti, pero nos queda camino por caminar para terminar esta pandemia. Que pasen buen día.
Thank you, Dr. Luna. Happy to take questions.
Hi, it seems in Ohio and possibly other states, incentives did lead to a big jump in vaccinations, but the numbers went down shortly after. Does that concern you here? And what have you seen in Chicago in terms of the effectiveness of incentives?
Sure. So I think there's a couple of things here. We have not used the large incentives as much as a lot of other places have to date, partly because the hope is that adding these on now will drive continued conversation and interest in them. These are all using federal dollars, of course, but it's thinking about the timing. I think anything that keeps people talking about vaccine is a good thing. We know that we are working a lot harder to get every vaccination at this point than we were previously. And we also know a lot of people are tired of talking about COVID and perhaps not as, it's not as much front and center in terms of what people are thinking about. So I'm hopeful. I was very pleased to see the governor in the state announce this because I do think it's potentially a big deal. We are not just, focused on incentives. As you heard, we're really changing our programming, working on making sure we're having it available. But we have seen a lot of people when there is something that just kind of tips it over the edge to get that vaccine. The Six Flags tickets, for example, have been very popular among younger people and families where they're saying, I am going to go out of my way and get this vaccine because this has been available. And I'm hopeful that something like a college scholarship is a big deal and that we'll see people and families making a decision for that as well. So, I think the goal is to make sure that anywhere where we have seen promise and seen real progress, we've worked to adapt that and add that onto our base kind of door-to-door work here.
With all the incentives you're doing, plus expanding the at-home program, do you think any of this is going to help some of those zip codes with low vaccination rates? Especially, I think 60621 is Inglewood. It's still in the 30s. Only, 20-some% are fully vaccinated?
Yeah, so Englewood is our least vaccinated community. This is all in addition to what we continue to do for Protect Chicago Plus. So we are right now and continuing to be out in the 13 least vaccinated communities. Literally, the teams are knocking on every single door in those unvaccinated communities and talking to people as they answer the phone about vaccine, signing people up for vaccine on the spot, whether that's at home or in some of the neighborhood groups. And the good thing that we've seen is that where you connect with people, there still are, we're seeing about half of the people where you have this conversation are willing to get vaccinated. They just haven't necessarily gone out of the way, or there's been other barriers in place. And we continue to be very encouraged by the fact that when we are out and about, there are lots of opportunities and we're still learning, I think, about which sites are the most valuable. But for example, we were at the Swap-A-Rama, which is a big thing that people like to come to in Chicago, and even over Father's Day, even without a lot of advance attention, had many people decide to get vaccinated in that site. And so we're trying to think about all of our work continues to be primarily focused on these least vaccinated communities, but messaging and getting people talking about vaccine is as much a part of that as the logistics. And we think having these, some more incentives and some more of that kind of conversation also helps to drive the conversation in those neighborhoods.
Are you concerned about the Delta variant in those locations, those specific zip codes? I mean, Dr. Fauci said today it's now 20% of the cases in the United States. That's double from what it was last week. He thinks it's going to continue to double. We're on track, like of the UK, if we don't get these neighborhoods vaccinated.
Yeah, so related to the Delta variant, certainly we are seeing it growing here in Chicago, just as that's true across the country. We've had, I know, at least 70 cases of that Delta variant detected here already. And those are all over the city where we look geographically, but they are very, very, very strongly concentrated in unvaccinated Chicagoans. And so the way I really think about this is that all of the variants, this is really the virus, the pathogen evolving. And whenever we think about epidemiology, we're always thinking there's this triangle where we think about the host, meaning us. What are we doing in terms of our behavior? What are we doing to get immunized or to be protected against COVID? And that changes over time. There's the pathogen. So in this case, the virus, which is going to evolve to try to evade vaccines, to try to be more infectious. And then there's the environment, things like seasonality and how well can the virus be able to survive. And so we're always sort of looking at these. And the part about the pathogen, the virus, I fully expect this virus to continue to evolve. Right now, if you are exposed to COVID in Chicago, you're more likely to be exposed to a variant than you were previously, meaning you're actually more likely to get COVID if you're exposed to someone who has COVID. It's just that we have less COVID around, and so broadly the numbers are lower. So all three of our vaccines, luckily, remain protective against all of the variants, including that Delta variant. There was a big study out of the UK for the Delta variant that showed the Pfizer vaccine, for example, if people got both doses, it went from being in the 93 to 95% protection to about an 88% protection. That's still a very good protection level. But people who had only gotten one dose of that Pfizer vaccine, it dropped from about a 50-something% protection to only a 30-something% protection. So it's important that people get both vaccines, particularly if they're concerned, as I hope people are, about variants. And we are seeing all cases, not just the variants, really landing in unvaccinated neighborhoods and especially social networks. So that's where we are continuing to put our primary focus.
Good afternoon. So of the 70 Chicagoans who have the Delta variant, how many of those people are hospitalized?
So the majority not, I know. I don't have those exact numbers in front of me right now, but the majority have not been hospitalized. And there are still questions actually outstanding about whether the Delta variant makes people sicker or whether it is just more infectious, more contagious. We know that it is more contagious, and the kinds of mutations that it has, there's a few different mutations on the spike protein itself, makes us concerned that if we see further mutations from that, we could have problems with vaccine in the future. But the great majority, at least I know for a fact, have not been hospitalized. And again, the great majority of the people who have been diagnosed are people who are not vaccinated.
Not an anti-vaxxer, but a lot of the parents I spoke with are quoting the WHO, who recently said that children should not be vaccinated for the moment that are 18 and younger because there's not enough evidence on the use of vaccines against COVID-19 in children.
So the WHO is making recommendations, obviously broadly across the world. And there is a lot of, the US is unique, almost entirely unique in having enough vaccine widely available for all ages. In most countries, there are still countries that have not been able to even start vaccination yet in terms of access. And there are many, many countries that are still very focused on that oldest population. The other thing is that the WHO is looking at the wide variety of the vaccines that are available around the world, including vaccines, that are from Russia and from China that have had different studies and sort of different efficacy. The vaccine, the only one that right now is approved for teens in the US, the 12 to 17-year-olds, is Pfizer, and that absolutely remains recommended here in the US, and that is true from the American Academy of Pediatrics, it's true from the CDC, it's true from really all of the bodies in terms of where we think about the risk-benefit ratio. So where we're looking at the US, it's focused on what vaccines are available here, and then what the evidence and the data has looked like in the studies that have been done here. And that's why that recommendation very much is in place. And I encourage parents of anybody 12 or older to go ahead and get that vaccine. And that's what I have told my own friends and family to do.
Any update on canvassing numbers, such as response rate, appointments, and has your team learned anything surprising about vaccine hesitancy during these conversations?
Yeah, so we continue to really collect data, and the team is working to assess what are we seeing in different parts of the city that may be different. What we have seen is that there are different rates of opening the door, for one thing, in different neighborhoods. And we are seeing in the sort of 30 to 40% range broadly of people sort of willing to open the door and engage. That's pretty good compared to where we look at, for example, some of the door-to-door work that was happening related to census sign-up. But it's still not ideally where we'd like to be, which is why we're also trying to make sure that we're in community spaces where people are out and about. We have definitely seen that there are still a lot of people out there who don't know that the vaccine is free, which is a surprise in some level to me. But on the other hand, it just points to the fact that we never have things that are free in our healthcare system. And I think we have people still who don't believe that they're not going to get a bill later, or that in some way this isn't going to be a cost. And so we've been trying to increase our sort of messaging around that. There also are people who believe that their information, if they get vaccinated, is used differently than it is. So we've been trying to emphasize and educate people about the fact that their vaccination information is available to their healthcare provider, to the public health system. It is not shared outside of that. But this is some of the mistrust, I think. And we are still hearing a lot of misinformation about the COVID vaccine broadly. There are some pretty strong, there's some strong messaging out, I think particularly on social media, that is not particularly based in science, but has gotten a lot of traction. And so our vaccine ambassadors do spend a fair bit of time helping just educate people and answer their questions. But at the end of the day, we are finding where you have this engaged conversation, about half of the people, I mean, that's the rough number, are willing to get a vaccine. And so that's part of this desire to think about let's expand the at-home, let's really get rid of any barriers we can think of to access. It's a certainly more resource-intensive way to do it, but it's been a piece of it. I think the last thing is that it's been, I think, important that we've been working with community-based organizations that are based in the communities where we're knocking on doors. Definitely people feeling more comfortable, obviously in their native language, or with someone who looks like them or is from their community. That also is not a surprise, but I think has been a lesson that we've heard back from the canvassers, and just that it can be a multiple conversations around this, I think are important.
I just have two quick questions. How many children 18 and younger have died from COVID in Chicago, and did they have comorbidities?
3 children under the age of 18 have died. That's available on the dashboard. They all had at least one comorbidity.
Okay. And then how many people are in the hospital right now, and how many are in ICU and on ventilators? Do you have that information?
So approximately 150, give or take. Our average right now is about 117 in the non-ICU, but the most recent data was about 99 to 100 in the non-ICU. And then we're in the sort of 47 to 50 range as far as ICU. Right now, 30-something of those folks are on ventilators. So this is the best that we've been doing. And then in terms of admissions, for Chicago residents, we are seeing fewer than 10 right now. And that goes along with having, we're diagnosing just, fewer than 50 cases a day, seeing fewer than 10 hospitalizations a day, and feeling good right at the moment in terms of the progress that we've made and continue to make. But the great majority of those folks getting hospitalized, again, are people who haven't been vaccinated. And the worry is that as the pathogen continues to evolve, as our behavior, understandably continues to loosen around other ways of protecting ourselves, and then questions like seasonality, that's where we worry a little bit about what may be coming. But the news is good right now.